I think this is your PRN. So similar with your previous pages. So the surname is Boniface and the forename is Andy. All details are still the same, and I'm happy to proceed. So as required medication, again on your list, this should be the last. Okay, the last medication that you're giving the patient. Okay, so because you only give this if the patient needs it. The first medication is paracetamol. So the date was yesterday. So that means sorry, I pressed something. Sorry, say date was yesterday. It was prescribed yesterday. The dose is 1,000 milligrams. The frequency is 4 to 6 hours. The route is per orem. Duration is ongoing. The start date, it was yesterday. The finish date is ongoing. Instruction is for pain. Signed by Dr. Khan, 123. Print name, Dr. Khan. At this point, you ask the patient, Andy, are you in pain at the moment? Let's say Andy said, yes, nurse. Do you want some painkillers? Of course, nurse. How would you rate your pain from 0 to 10? 0, no pain, and 10 being the highest. Um, Around 4, nurse. Okay. Shall we give this paracetamol or not? It's 2 o'clock, remember? What do you want to check first? Stat meds. There you go. Once you reach your TRN, you go back to your, similar with the old test of competence, you go back to your stat doses. Let's try and review your stat dose. Yeah. All right. Let's see. So the paracetamol, it was given today at 11 o'clock. Yeah. Can you see it? What time is it now? It's 2 o'clock in the afternoon. So let's count. 11, 12, 1, 2, 3. So that means, can we give the medication or not? No. Well done. Well done. Thank you, guys. Well done. Thank you for your answers. So I hope you are now getting the technique on your implementation chart. Yeah. So whenever you reach your PRN, you go back to your stat dose and then also analyze your regular medication. Probably it was given already. That means you will simply tell the patient, oh, Andy, your paracetamol, unfortunately, I cannot give your paracetamol yet because the last time it was given was 11 o'clock. So 11, 12, 1, 2, 3. It's not due yet until the next hour. So probably for now, take some deep breaths. You said your pain score is 4. If you want a medication, of course, I could ask the doctors if they could prescribe you something. Yeah, will that be all right? Oh, nurse, probably I'll just wait for another hour before you give it. Yeah, I can still tolerate it. If the patient said, yes, oh yes, nurse, give me something, then you ask the doctor to prescribe something. Okay? So that is your PRN. So are we all happy with that? Okay. So next medication is salbutamol. Next, salbutamol, it's today. Dose is 5 milligrams. The frequency is as required. The route is nebulization. Duration is ongoing. Start date is ongoing. Finish date is ongoing. Okay? Signed by Dr. Khan, bleep number 123, and print name is Dr. Khan. So what is your next question? Say probably, Andy, are you still experiencing shortness of breath at the moment? Oh, let's follow our technique. Remember, when you go to PRN, you go back to your stat dose. When was the salbutamol last given? So it was last given today around 10 o'clock, 10:30. So just to ask guys, I don't know if you know the answer. How frequent can we give salbutamol? How frequent do we give salbutamol? Because it doesn't say here what's the frequency of administering salbutamol. Is it every 4 hours? Every 8 hours? Every hour? Every 30 minutes? Every 5 minutes? Of course, 15 minutes is also possible. I don't know if you experienced giving salbutamol every 5 minutes. Of course, you can check with the doctors if how frequent they want to give it. But is it possible that you're giving this salbutamol for the patient? Of course. But remember, going back to what I've said earlier, you are not meant to administer nebulization. So patient might be telling you, nurse, I'm fine at the moment. Yeah. So going back to what I mentioned earlier, you are not expecting to administer nebulization on this patient. Okay. So I hope you remember that. But in case, can you give this medication? Of course. But you will not see any nebulization in your drug trolley. Okay. So that's it. Last but not the least, on the last page, before we move on our community drug chart, so that is easier. So surname is Boniface Andy, and the rest of the details are still the same, and I'm happy to proceed. So for infusions, nothing is prescribed, and that ends my drug chart. So again, it's also a good habit if you're summarizing what you're giving. The following medications are the things I have to administer. So number one is your paracetamol, prednisolone. This one is for your breathing. It's your steroid. I'm not giving your comoxicla because you're allergic to penicillin. I'm not giving your clarithromycin yet because it's due tonight. Same with your theophylline. I'm not giving it because it's due this evening. The next medication I'm giving is your levothyroxine for your hypothyroidism. And those are the medication I'm going to administer at this point, Andy. Prepare your medication, check the integrity of the bottle, and then expiration date. And once you're happy, go back to your patient. You may or may not check the patient's ID identification. That's up to you. But then again, if you don't want to check it, that is fine. And then administer the medication and make sure the patient swallow the medication. Okay, you can ask the patient, have you swallowed the medications, Andy? And if the patient said yes, then you carry on. You carry on documenting your procedure. So Levelin is asking, can we put a dot? Normally, putting a dot on your drug chart is not acceptable as your documentation, okay? But I know so far we have a couple of candidates before who placed a dot and they passed, okay? So that means it's fine, but I do not recommend putting a dot. Why? Because it's not in line with the NMC standards, okay? Putting a dot on your drug chart is not, it may cause confusion with the other nurses, or again, you are not following the standard of practice. Okay, it's not safe practice when you're putting a dot on your drug chart. So how are we going to document this? So let's go with your stat dose. So for this one, prednisolone, what's the time today? It's 1400s. And I need to just put my initials. Okay, that is it. That is the only thing you have to put on your stat dose. Yeah. What code are we putting here? Code number 10 and your initial. Okay. That's the only thing you have to remember when you're documenting this. So this is the only thing that you have to write. So it says here, date and signature of the nurse administering the medication. Again, you don't have to put the date. Why? The date is already given. It says here today, and the time is already there. It's 1400. Yeah. So you only need to put the code and your initial. Okay. That is it. Next is your clarithromycin. Of course, it's not due yet. So we're not writing anything on this section. Again, it's not due yet. Remember, we are not omitting it. It's simply not due yet. Next is your theophylline. We are not omitting it as well. It's simply not due yet. So we are leaving it blank. Levothyroxine, we are giving this medication. Of course, we are signing it. Do we need to put the date and time? No need, because the date is already provided, similar with your time. Okay, so that's it. Last but not the least, paracetamol. Please help me, guys. We said that it's not due yet. Are we omitting it, or are we writing anything on this section? The answer is no. What if, okay guys, what if it's due? How are you going to document here? So let's say paracetamol is due, nothing was given previously, or it's now time for you to administer the next dose. We can write the time, which is 1400s, and today you have to put your initial. Okay, I hope you're following. So on the box intended for today, you will write your initial, and the time, you will write the time. Okay, the time. I think there is a mix up on this document. So this one should be today. I'm really sorry. And then this is tomorrow. Yeah. So it might be like that on the examination. So you will be writing ED here. Okay. That's it. Next is salbutamol. Similar with your other medication for paracetamol. Of course, you are not writing anything here because the patient doesn't require it yet as of the moment. Okay. That is your PRN. And at the back page of this document, you have to write, you have to fill out this table. Omitted doses of medicine, coded 10. So guys, remember, on the instruction, it says here, only write the medication coded 10. Okay? So that means if you see code number 2, code number 1, 3, 4, and so until 9, you don't have to write it here. You only need to put the code on the appropriate box on the previous pages. But if it's others or number 10, you have to write it here. So an example is, I'm just using red pen so you could see it. The day, the drug is, what medication are we writing? It's the coamoxiclav, yeah? Coamoxiclav. I hope my spelling is correct. There you go. The route is per orem. No, it's 500 per 125 milligrams. And the route is per orem. Instruction, I think nothing was written. The time given, are we writing anything here? Of course, it wasn't given. So you will write not given. And in here, your signature, of course, that is it. Of course, on the pharmacy section, you're not writing anything because you are not a pharmacist. Okay? So these are the only things you have to write on this section. Let's say coamoxiclav, all right? No, not this one. Let's say theophylline. What if there is no finish date? Will you consider this as a valid prescription? So the answer is you are giving it. Yeah, the answer is yes. Let me give the example of the amlodipine. Remember, earlier I've mentioned that amlodipine could be one of your maintenance medication. So if you said maintenance medication, the patient might be taking that medication for the rest of her life or his life. Okay? So there is no finish date. Okay? We have a couple of people who failed the examination because of they said there is no finish date and that is an invalid prescription with regards to that. So Emmer, in here, antibiotics, I could see for 5 more days. Why do you think the finish date is important for antibiotic? Of course, we know this. You cannot take antibiotic forever. So normally, we only take the antibiotics, say, for 5 days, 7 days. But of course, you are not taking antibiotics forever. Okay? So please do remember that. So just to recap, for antibiotics, probably there's an end date. For medications, as a regular medications, maintenance medication, if you don't see a finish date, that means it's still a valid prescription. You go back to your first page. So don't forget to write your name and your initial and then your signature. And of course, your ward. What's our ward? I think it's medical assessment unit. There you go. Wrong spelling. Okay. So on this table, you have to put your signature. Last one before we end our session. This one is like easier. So this is your community. Where's my community drug chart? Okay. All right. So this is an example of your community drug chart on your examination. So the scenario, let's say Mariana Grande lives in a hospice care. Mariana has recently been discharged from the hospital due to decrease in appetite following the recent death of her husband and has a PHQ-9 and a high PHQ-9 score. Please administer and document Mariana's 2200 medication safely in accordance with the NNC standards. So based on our example, on our scenario, you are meant to administer the 10 o'clock medications, the 2200 medications, yeah? So similar with your other document, you're given 15 minutes and same instructions, okay? So let's read it quickly. So surname is Grande, forename is Mariana or Mariana Grande. Date of birth is 7 of the 5th, 1945. Hospital number 415422435. And it's really long. The ward is hospice care home. Okay, at date of admission yesterday, the height is 1.73. The weight is 76 kilograms. BSA is 1.89. Consultant is Dr. Jones. Time of admission is 14:30. So signed by Dr. Jones, GMC number 1234568. And signed by Dr. Jones, the bleep number is 456. The patient is allergic to latex. The patient's the effect is rashes. Signed by Dr. Jones, bleep number 456 today. So details of the person administering the medication. So name is Raja Hill, initials RH, signature is R Hill. Base is hospice care home. The patient risk factors. The patient is hypertensive. The patient has osteoarthritis and with high cholesterol. Okay. So again, remember this section. It might give you a hint on what's coming next. Next,
Mm.
next page. Hospital number. Surname is Fergande. Forename is Mariana. All the details are the same. So this is how it would look like on your examination. Okay. It's kind of less complicated as the other one. So date of medic date, today, the drug is Ramipil, the dose is 2.5 milligrams, the time is 8 o'clock, frequency is once daily, the end date is ongoing, signed by Dr. Jones, GP, yesterday. So now you can see the word or the letters GP indicating that it is prescribed in the community. Of course, you will not see a bleep number in the community. Okay, so signature, date, and time, signed by Raja Hill today at 8 o'clock. So that means this medication was given by Raja in the morning. Next medication, paracetamol, it's 1,000 milligrams, 8 o'clock, 4 times a day. The end date is ongoing. Special instruction is for pain, signed by Dr. Jones yesterday. It was given by Raja Hill today, 8 o'clock in the morning. Next medication, again today, another paracetamol, 1,000 milligrams, 12 noon, 4 times a day. And it is ongoing for pain, signed by Dr. Jones, GP, signed yesterday. It was given today by Raja Hale at 12 noon. So that means you can see all the paracetamol given to the patient all throughout the day. Okay. Next medication, another paracetamol, 1,000 milligram, 1800s, 4 times a day, ongoing for pain, signed by Dr. Jones. Yesterday, it was given by Raja Hill today at 1800 hours. So that means it was given 1800 hours. Remember, you're meant to give your 2200 medications. Okay. Sorry, I'm a bit rushing now, guys. So last medication is your paracetamol, 1,000 milligrams, 2,200, 4 times a day, ongoing for pain. Dr. Jones, GP yesterday. Are we giving this or not? Yes. Yep. We are giving this medication. So part of your conversation, you could ask the patient. Let's say, what's the patient's name? Mariana, I can see you have your paracetamol here again. So, are you still in pain? Because instead, remember, the instruction is for pain. Remember, this is a regular medication. So, oh, nurse, what if the patient said, oh, no, nurse, I'm no longer in pain? Okay. Um, what will you do next? Will you still give this medication or not? Okay. That is my question. Okay. So in case the patient said for, let's say for painkillers, let's say the patient, this is a regular medication. Yeah, correct. So let's say there are two possible answers. Okay. There are two possible answers. Thank you for your answers, guys. All your answers are correct. So the first answer is, let's say for the people who said we are giving this, that is correct. Why? The reason for that is probably Mariana is not experiencing pain at this very moment because looking back on our drug chart, it was given at 6 o'clock in the evening. So probably if you are not giving the paracetamol today or now, the patient will complain of pain in the next coming hours. Is that correct? That's that. Yeah, that's fine. You're happy with my explanation. The other possible answer is, let's say, oh nurse, I don't. Let's say I'm not in pain anymore, nurse. Let's say, do you want to? Let's say you ask the next question. Do you want to take this medication? What if the patient said, oh, it's up to you, nurse. Okay, you decide if you're going to give it or not, which puts you in a difficult situation if you're giving it or not. So what if you decided not to give this medication? Will that be correct? That is also correct because it's based on your judgment. Okay. If you think the patient doesn't need it, that is fine, even if it's a regular medication. But the most important thing that you have to do next is to put the omission code. Yeah. So what we know so far, so from our candidates, some of them gave this medication, some of them did not administer, all of them passed. The most important thing is if you're giving it, you sign it. If you're not giving it, you put the omission code and you sign it. Are you all happy with my explanation? But if it's me, if I'm the one, if I am the nurse on this situation, probably I will just give it because again, Mariana might complain of pain in the next coming hours. Last page before we end our webinar. I hope you're enjoying, guys. So last page is surname is Mariana against Mariana Grande. All the details are still the same. The next medication is sertraline today, 100 milligrams. The time due is 2200 hours, once daily. The instruction is for depression, signed by Dr. Jones yesterday. Are we giving this or not? we are giving it. So we are giving this because it's due now. Remember on the scenario, the patient was admitted or the patient came back from the hospital following a depression. So this sertraline, we now know that sertraline is an antidepressant. Last medication, simvastatin, is 20 milligrams, 2200 hours, once daily, ongoing for high cholesterol, signed by Dr. Jones, GP. Are we giving this or not? We are giving this. Same with your sertraline because it's due. So infusion, nothing prescribed. So Mariana, to summarize, the medication that I'll be giving: paracetamol for your pain, sertraline for your depression, and of course your simvastatin for your high cholesterol. Okay? Remember my tip earlier on the medication risk factors? All of the following are listed. Yeah, except for hypertension. So the last page is your information, okay, the codes, okay. It's kind of set up differently on your community drug chart because the codes will be written at the end of your drug chart, okay. Any questions? So how are we going to document this? Last one. So you put your name, which is, say, Emer Diego. I'm always the nurse. Initial, ED. My initial is, signature is, say, ED. And hospice care home. And we have to document this. So in here, as compared to the other drug chart, you need to actually put your signature, the date and the time, because it's not provided. So Emer Diego, you will write the date, let's say today, to indicate the date and the time, which is 2200. Okay. So this one is also applicable for your next two drug chart. And that ends our community drug chart. So similar with your previous drug chart, in case you're omitting something, you have to put it here. Again, for only codes 10, and you have to state, you fill out the remainder of your tables. Any question?